2nd Street in New York City. You're watching PIX Morning News.
Welcome everybody to the 8 o'clock edition of the PIX Morning News. I'm Sukanya Krishnan.
And I'm Tiffany McElroy. Coming up this morning in the 8 o'clock hour, pregnant ladies, listen up, Suki. Should having a bun in the oven keep you away from the dentist chair?
I haven't gone, to tell you the truth.
Okay, well listen, we're going to find out when we debunk some of the most common teeth myths. That's coming up in just a few minutes from now.
Who knew? I want to hear about this.
Well, from baby teeth to braces to cavities, crowns, and costly tooth extractions.
Yeah, we all know that caring for your teeth is no laughing matter, and our Dr. Steve Salvatore has more. Steve.
That's right, Suki and Tiffany, but you can smile a little easier if you know a few facts that can help you prevent those dreaded dentist visits, although I have a good time with my dentist. Here to clean up some common teeth myths is Dr. Gregg Lituchy. Thanks for coming this morning.
Thanks for having me.
All right, let's get right to it, because a lot of people think that candy, that's a myth, is bad for your teeth. We know it's kind of bad, but what's the truth with an explanation there?
Candy doesn't cause cavities. Take it from somebody who loves chocolate and eats it all the time. If we leave the sugar on the tooth, then we have a problem because the bacteria in your mouth will turn that sugar into a cavity. So as adults, we have to be really diligent in flossing and brushing to remove the sugar, and if we do that, we can eat that candy guilt-free.
Oh, that's good. And chocolate is sometimes better than some of the sticky stuff that sticks in your teeth, right? Okay, so chocolate, ladies, hey, good reason there. All right, chewing gum, another myth. People think chewing gum is bad for your teeth. What's the truth?
Would you believe that chewing sugarless gum is actually good for your teeth?
Yeah, I knew that.
First of all, for people who are under stress like you, Steve, it can relieve a lot of tension. But more importantly, what the chewing of the gum does is it increases your salivary flow in your mouth. So the saliva is bathing the teeth, washing off not only the surface stains, but it's actually neutralizing the acid that the bacteria cause, which cause cavities. So it's actually beneficial to chew gum today.
All right, but again, it's got to be sugarless.
Got to be sugarless.
That's the whole point. Okay, speaking of whitening and getting rid of stains, a big misconception is that if I do the whitening, I'm going to have that perfect Hollywood smile. What's the truth?
I wish that was true.
Right, wouldn't it be true?
Some people's teeth do not bleach at all. Other people's teeth bleach great. Most people fall somewhere in between. But I will tell you this, when the teeth do bleach, it never lasts forever. It requires touch-ups, sometimes a year down the line, sometimes 6 months down the line, sometimes even 3 months down the line in people whose lifestyles include drinking tea, coffee, and red wine.
Okay, but a lot of people then go for the next thing, which is the whitening toothpaste. But what's the reality about how effective this is going to be?
Whitening toothpastes do not bleach teeth. In order to bleach a tooth, the bleach has to sit on the tooth structure long enough to get through the enamel into the inner layer of tooth called the dentin. What whitening toothpastes do very well is they remove the surface stains on the enamel so they can make your teeth look whiter, but it's not actually bleaching your teeth because you're only brushing your teeth for 2 minutes.
Okay, so it's kind of like a maintenance kind of thing.
Sure.
All right, another big myth. I loved it. I always wanted one of these when I was little. A big myth that a bristle brush has to be hard to be effective. What's the truth?
You have to stay away from hard bristle brushes. I don't even know why they make them anymore.
Right.
Because plaque is soft, so it only requires a soft brush to remove it. If you use a hard brush, you can not only damage your tooth, it actually can wear away the enamel of the tooth, but it can also cause gum recession. Once the plaque calcifies and becomes tartar, you can't brush it off anyway. You got to go to the dentist and have the hygienist scrape it off.
Right. It's one of the things you got to teach your kids. You know, you always see the kid go scrubbing so hard. It's like, take it easy. You don't
want to
do
scrub hard. You want to go nice and easy.
Exactly. All right. Another myth: people think that brushing is as good as flossing, and the two are interchangeable. But the truth is, you really should do them together. Right?
Exactly, because brushing and flossing do two different things. The brushing removes the plaque and the germs that are on the flat surfaces of the teeth. But your brush can't get between the teeth. That's why you have to floss. In fact, for my patients, I actually recommend adding a third thing to the daily regimen, which is to rinse with an anti-cavity fluoride rinse, such as Listerine Total Care, to help fight tooth decay. Because if you're rinsing, brushing, and flossing, you know you're doing everything possible to have a healthy mouth.
Okay, and just last, real quickly, for Suki, who's pregnant, there's a myth that pregnant women should not get their teeth cleaned. But I know Suki probably knows the truth to this one. The truth is?
First of all, Suki, congratulations. Second of all, if Suki was my patient, I would tell her, when you're pregnant, your estrogen levels go really high. This has a direct effect on the gum tissue, causing inflammation, redness, and bleeding. Not only do you need your teeth cleaned while you're pregnant, I recommend that you have 3 cleanings during that time to combat that inflammation of the gum tissue.
All right, so Suki will see you in the office this week.
I'll see you there.
An appointment.
Would love to.
Lituchy, thanks so much for coming in.
Thank you.
All right, for a complete list of the entire list of tooth myths, go to our website, WPIX.com/morning news. Ladies, back over to you.
I am guilty, Dr. Steve. You think I'm better than I am. I've only done it once, so, you know.
Make an appointment.
Make an appointment is right.